weeks of age, she stopped being able to move her head, arms, and legs. At 16 weeks of age, she was unable to take a bottle without coughing and choking. At 20 weeks of age, she had such difficulty breathing that she had to be hospitalized and put on a breathing machine. At 6 months old, Stephanie was diagnosed with spinal muscular atrophy. Spinal muscular atrophy is a relatively common children's genetic disorder that's often devastating for the families that it affects. According to Spinal and Kaufman, SMA is the leading cause of hereditary neuromuscular disease and the #1 genetic killer in infants under 2. 1 in 40 people, most unknowingly, carry the gene for this deadly disease. And according to the article by Tidy and Wright, if both parents carry this gene, your child has a 25% chance of developing this disorder. Today, I would like to discuss 3 aspects of spinal muscular atrophy. We'll talk about the definition of the disease, the treatment options, and the most common symptoms that you would see. First, let's look at the definition. SMA is a genetic disorder that affects the spinal cord and nerves. Often, it affects the spinal cord and nerves, often resulting in muscle wasting and weakness. SMA is classified into 1 in 4 types based on severity and age of onset, according to D'Amico, Bertini, Tiziano, and Mercury. The most common is noticed at birth or soon thereafter, and it's usually fatal by 2 years of age. On the other hand, when a child is diagnosed at 18 months or after, life expectancy is 20 to 30 years of age, and the disease is usually less severe. Now that we've discussed the definition, let's look at the symptoms. Symptoms are usually noticed at birth, but may not develop until months or years later, and they typically get worse over time. Infants that are born with very little muscle tone are classified as being called a floppy baby syndrome. Doctors may suspect children that have SMA when they have difficulty meeting their developmental milestones. And according to D'Amico et al., their milestones would be having difficulty holding up their head, rolling over, sitting up, standing, or walking. Muscle weakness may also cause difficulty breathing. Infants may gasp for air or turn blue in color. The recurrent infections in children, older children, doctors may suspect spinal muscular atrophy. Feeding problems may also be seen due to muscle weakness. Key symptoms may be evident as choking or coughing during swallowing. Infants you may notice in your infant that they have a very weak sucking reflex. Finally, treatment strategies. According to the neurological disorders in stroke, there is no known cure for SMA or no known treatments. Treatment options include managing symptoms, preventing complications, and largely dependent on the age when the child was diagnosed and how the symptoms develop. Weakness in arms and legs may require physical therapy, braces, walkers, and or wheelchairs for assistance. Nutritional support may include a child having to have a feeding tube placed due to the inability to swallow whole foods. Respiratory support may include supplemental oxygen, positive pressure masks, and all the way up to permanent ventilator support or breathing machines. In summary, SMA is a disease of the spinal cord resulting in muscle wasting and weakness. Symptoms of muscle wasting may be seen as a lack of muscle tone in arms and legs, movement that is known as the floppy baby syndrome, and breathing or feeding difficulties. Treatment concentrates on managing symptoms and preventing complications. In conclusion, currently there is no known cure for SMA, but there is great reason for hope. Scientists and doctors now know what causes SMA, and there's a great deal of research being done. 10 years ago, there were very few drugs on the market to treat SMA, and currently, according to the Cure SMA website, there are 5 now in clinical trials. And with ongoing research, SMA is potentially a very curable disease. Thank you.